Minister Bent Høie, a Minister of Health and Care in Norway, thank you very much indeed for talking to us.
Thank you.
So Norway, by some reckoning, the world's richest country, and you have a health system that is the envy of many countries in the world. But what Norway really shows is what the report highlights, that you can only have a good health system if you have the commitment of the politicians and leadership at the highest level of government and other sectors. That's a very important thing that we should all remember.
Yeah, the health and care system in Norway is core of our welfare system. And in Norway, everybody have their own GP. So they have around 1,000, 2,000 people that are on their list. And also every woman and child have a connection to a nursery system, and also the children in the schools have the possibility to see a school nurse during the school time. So this is important, and of course it's 20% of our employment is in the health sector. 80% of the people working in the health sector is women. And therefore it has been very important for me as a member of the Commission to say that this is also a gender issue, because if we have the possibility to make good works for women, then we also have the possibility to have a very strong factor for economic growth. In Norway, the women's participation in labor is more important for our economy than the oil income.
So that 20% of the Norwegian workforce that's employed in the health sector demonstrates really what the title of the report is, which is Health, Employment and Economic Growth. And you very clearly demonstrate the link between the two.
Yeah, it's clear. It's of course clear that it's giving people better health, and that's the most important part. But it's also a very important part of the economic drive. And especially when you see this as a gender issue, to make the possibility for women to have a safe job with a decent income, then they all participate to give more back to the society, also economically. And as I said, the lesson from Norway is that this is more important for us than the income from the oil industry.
As the years go on, I think it's projected that by 2060, the 20% of the Norwegian labour force that's involved in the health system is going to practically double to about 38%. Is that something which you think is a good thing? It's something which will continue to generate economic benefits, or might people see it as a kind of drag on the economy?
In Norwegian perspective, it's not possible to see that development. We have to manage our health system in another way. We have to introduce new technology, as is also a recommendation in the report, and we also have to change our health system so we have more primary health care, and that's also a part of the report. So I see that the solutions for also countries that needed more health workers, and countries like Norway that also will need more health workers but cannot have the same growth as we have the last 20 years, the solutions are the same. So this report is important for Norway, important for middle-income countries, and it's important for low-income countries.
I think one thing that is very, very striking about the report is really when you look right across the world, the lack of data, or in some cases about the factors, to take into consideration when you're looking at how to improve the health workforce. It's really quite startling that in some cases we're dealing with a real deficit of statistics.
Yeah, we need more data, and that's the last recommendation from the Commission, because we need data to be prepared, and we need data to know how the situation is developing in the different countries, and that is also important both for the high-income country and the middle-income and the low-income country. So we need more data to be prepared, and of course to have solutions in the rich country to have a better way of organizing our health system, a better outcome, is also a part of solution for the lower and middle income country, because we cannot come in a situation where we are draining the lower income country from having their own health personnel because we are paying them better income. So the immigration issue is also very closely connected.
Minister Bent Høie, thank you very much indeed for talking to us. Thank you, and all the
you.
best of luck in your ministry in Norway.
Thank you very much.
Thank you.